big question about PEMFs and cancer. And there's a section in my book, Power Tools for Health, on the use of PEMFs in cancer. So there's the book, Power Tools for Health. PEMFs have, I think, a very important role in cancer. They don't cure cancer. I will never, ever say that magnetic therapy cures cancer. In fact, actually, there aren't a whole lot of therapies that cure cancer. So I wouldn't necessarily even rely on chemotherapy and the traditional medical approaches to cure your cancer. So we know now that there are relatively few cancers that are, in quotes, cured, although doctors basically say if you survive 5 years after your treatment, you're cured. Well, that's a falsehood. So cancer, to me, basically, once you have that diagnosis, is a chronic disease. You didn't get it overnight. It took years to happen. And that's a chronic condition. So that means the condition that was there that caused the cancer to develop in the first place had been there for a long time already. So I recommend thermography for women postmenopausally. I don't tell people not to do mammography, but you can combine mammography, less mammography, and more thermography. And the reason thermography may be very helpful is it can detect cancers years ahead when they're finally able to be detected on a lesion being detected on mammography. And that's because the process has been there for a very long time. It takes 10 to 15 years for cancers to go from one cancer cell to double, to double, to double, to double. In other words, the doublings take a long time before finally you have a detectable lesion. So most cancers, especially solid tumors, have been there for a long time. And most other hematologic cancers like leukemias and even lymphomas have usually been brewing for a long, long time before you finally find them. Anybody who's doing magnetic field therapy on a regular basis for health maintenance is more likely to prevent the development and progression of cancer. It's been said that each of us has over, let's say, 100,000 cancer cells in our bodies on a given day. And there are different estimates for that. And the immune system takes care of it. So cancers often will blow up after a major procedure, heart surgery, appendectomies, gallbladder surgeries, hysterectomies. A year later, 2 years later, cancer shows up. Well, it didn't show up in that 2-year period. It didn't show up when you were discovered to have it. It was brewing a long time ago, and then the stress in your life at that time, that physical stress and emotional stress, and the drugs that we were given to deal with pain and sleep and everything else, suppressed the immune system enough that the cancer started to take off. But if you're doing magnetic therapy on a regular basis, you're decreasing the inflammation through the whole body, especially if you're doing health maintenance. And if you decrease inflammation in the whole body, cancer doesn't get a chance to develop. So anybody who has a family history of cancers probably should be doing whole body magnetic therapy with a sufficiently high intensity magnetic field system for their life, just to prevent that from happening. Never mind all the other benefits you're going to get. So in cancer, PEMFs have, when you actually have been diagnosed with cancer and you're going to have surgery, I recommend PEMF therapy before you do your surgery, because then you precondition the body to be as healthy as possible before the damage of surgery happens. And the body has to heal from the damage of surgery, never mind the problem with the cancer before. So do magnetic therapy before the surgery. Then as soon as the surgery is done, then you do magnetic therapy again. Magnetic therapy works very well with chemotherapy. In fact, it makes chemotherapy probably close to doubly more effective. In other words, it doubles the effectiveness of chemotherapy. Magnetic field therapy can be used with radiation as well. Although again, if you ask your oncologist about using magnetic fields with chemotherapy, they will know nothing about it. If you ask the radiation oncologist whether you could do magnetic therapy with radiation therapy, they will know nothing about it, and most likely they will say no. Also, the oncologist would be most likely to say no, because again, they don't know anything about it, and they're not going to go figure it out for you. So I'm saying that the research supports the use of PEMFs around surgery. It supports the use of PEMFs around chemotherapy, and it supports the use of PEMFs around radiation. Radiation is a bit more tricky, so I would do magnetic therapy to the tissues before the radiation starts, because it can actually act as a radiosensitizer to the cancer. So in other words, the cancer actually becomes even more sensitive to the radiation. On top of that, it helps to protect the normal tissues that are not cancerous from the damage from the radiation. And then after you're done the radiation, for sure, you can start magnetic field therapy again, because the cancer cells have been damaged enough that they're not going to recover from that radiation unless they're radiation resistant. So that's a problem, and that doesn't get discovered for some time. But the damage has already been done to the normal tissue. So you can use the magnetic fields if you start soon enough after radiation therapy, that you could recover the cells to the extent they can be recovered, because the radiation causes a lot of inflammation in normal cells. The tissues are red, they're swollen. Talk about mast cell activation. They're red, they're swollen, they burn, and certainly there's a lot of pain. And depending on what part of the body you do have radiation, again, very, very important to use magnetic fields. I had a consultation just the other day on somebody who had radiation to the jaw, to the neck area, and had basically melted the bones. It's called osteoradionecrosis. Developed melting of the bones of the jaw. And there are reports, there's no extended research studies, but there are reports of people who use magnetic field therapy to recover that bone. Nothing else does. The only thing you can do is to do bone implants, and they don't always work because the tissues are so damaged, there's so much inflammation that doesn't always work. But magnetic therapy can help to potentially cause the bone to regenerate, because they do that, magnetic fields do that. That's what they do in osteoporosis. And so that's a possibility. So that's an example of a case in which radiation was done that then caused damage, that the magnetic field therapy would help to recover that damage. It doesn't happen overnight. It's a very slow process. So that's my answer basically for cancer. I would also say, and people don't want to hear this, and oncologists don't want to tell you this either. Most solid tumors, by the time they're discovered, already have what let's call them daughter cells out in the body. They're individual little cancer cells that are broken off and gone out into the body. Those are called cancer stem cells. And a large percentage of people who have been, at the time they were discovered to have their tumor, the solid tumor, have been found to actually have these cancer stem cells. That's tricky. It's research. Basically, at this point, it's at the level of research to detect those stem cells in the bones or in other parts of the body. But they're at rest, and the immune system takes care of them. But how do they activate? They activate during stress. I mentioned if you had surgery. So if you had surgery 10 years ago for, say, part of a lung was removed, or you had a part of a kidney removed for cancer, then anytime down the road when you're going to have a procedure, a surgical procedure, that stresses the body. Natural killer cells, NK cells, go down in number significantly, they drop in number, and they're very important for surveillance of cancer cells of the body. So NK cells are critical. And if you use narcotics, if you use tranquilizers, sedatives, and there are other medications that do this as well, and you could look this up, and their impact on NK cells, natural killer cells, it's amazing how much they impact NK cells. One session of acupuncture, in other words, one session of magnetic field therapy, can reverse that drop in NK cell activity. So if a pearl that's a freebie for this conference has nothing to do with pain, but if you're going to have a procedure and you have a history of cancer, get one acupuncture treatment to a point on the leg called stomach 36. One treatment can make those NK cells come back very rapidly. So you can do that before the surgery, and you can do it right after the surgery, so that you, again, the surgical process itself will decrease the NK cells, so you can bring them back up again. And I do recommend treating stomach 36 periodically in anybody who has a history of cancer, just to keep the NK cells up. And you can have them measured. Your functional medicine doctor can measure your NK cell levels. All right, so magnetic field therapy then helps the body to keep those stem cells at bay, to keep them quiet. There's some evidence, not a lot, but there's some evidence that magnetic field therapy may increase NK cell activity, but the most important thing is to keep the tissues healthy. So when you keep the tissues healthy, then those stem cells don't convert. And so magnetic field therapy then can be used then for cancer prevention either primary or secondary, so after the fact or even beforehand. Okay, I hope that answers your question, Gary, about PEMFs and cancer. I strongly recommend the use of PEMFs in cancer. Now, if you have extensive cancer in your body, you need high intensity magnetic field therapy to the area that you're dealing with particularly. For whole body treatment, again, higher intensity magnetic field therapy is critical. The low intensity systems are just not going to do the job deep enough into the body.